medications have become a sort of a part of our culture in America. And at times we'll get the question, and I think it's legitimate to say, you know, wouldn't it be easier for me or cheaper for me just to take a pill or a medication to try to manage my headache or my neck pain or my back pain? Wouldn't that be a simpler, cheaper solution? I don't have to drive to the office. I don't have to pay a copay or pay for my visit. Is that really the best option for you? And I think that it's a complex decision. However, I think that there's some information that sometimes, because medications are just such a ubiquitous part of our culture at this point, that we just downplay or don't really understand the consequences of the decisions we're already making. So I'd just like to give you a little bit of some data here to help you along. So, you know, the most common prescription for headaches, neck pain, back pain in today's culture are nonsteroidal anti-inflammatories, which would be your ibuprofens or your Aleves, aspirin, things like that. But I think what people don't realize that according to the American Gastroenterological Association, 100,000 people are hospitalized per year in America due to NSAIDs. That's 273 people a day are being hospitalized due to NSAIDs. Ibuprofen, Aleve, aspirin. 16,500 people die each year in America from nonsteroidal anti-inflammatory drugs. So that's pretty serious. I mean, when I started into practice around 2001, it seemed like everybody that walked through my door was taking Vioxx. And Vioxx has been taken off the market because of the severe cardiovascular events associated with that. Unfortunately, Celebrex is still available to people, but the long-term use of these medications is concerning. And the longer you're on them, the longer you take them, the more concerning it is. The other area of concern in America is opioid use. And I think this is becoming more widespread and understood how serious this problem is. But let me give you a few numbers. There are 52,000 overdoses in America annually. 2/3 of those, 34,000 of those, are due to opioids. Oxycodone, morphine, hydrocodone. 91 Americans per day die from opioid overdose. They say that's twice as many as the number of people dying per day in Vietnam at the height of the war. 12 states in America, the number of prescriptions written for opioids exceeds the number of people that live there. That's how much these medications are being used. 81% of the world's supply of oxycodone is used in America, and nearly 100% of the world's supply of hydrocodone is being consumed in America. Now here's an alarming stat that I think we all need to digest. 4 of 5 heroin users say that they started with prescription painkillers. 4 of 5 heroin users say they started with prescription painkillers. So what I'm saying is that we need a non-pharmacological approach to address and deal with musculoskeletal, neuromusculoskeletal pain, headaches, neck pain, shoulder pain, hips, knees. And the research is very clear that chiropractic is a viable and effective and a research-based solution to these conditions. There have been head-to-head studies in Spine Journal of anti-inflammatories compared to spinal adjustments, and found that the spinal adjustments were more effective at relieving low back pain. Even things like Tylenol that are outside of NSAIDs for use were found to be no more effective at treating back pain than a placebo. So the good news is we offer you solutions here. We offer you safe, effective, natural solutions between chiropractic adjustments, nutritional advice, kinesiotaping, cold laser therapy, supplementation to reduce inflammation in a safe and natural way, safe and natural supplements that reduce pain in the body. There is another approach. There is another option for you and your family to keep you from heading down this path. It's a dangerous path. And life is about choices and decisions. And what we're recommending to you is that the time, the energy, the drive in the car, the copay, the fees, whatever it is you're paying to invest in your health is always worth it. You're always worth it. So we hope that adding this information to you will give you the ability to make better decisions for yourself, for your children, and your family, that you can choose chiropractic first, medication second, and drugs and surgery third, because we think that is the best conservative option. Have a great day.